Osteoporosis. What is it? This disease makes the bones in your body weaker and more brittle, leading to a higher risk of the bones breaking than a normal bone. Over 1 million Australians are affected by this disease. Causes. Our bones are at a constant state of regeneration, with the new bones being created and the old ones being broken down. When we are younger, we can replenish new bones and minerals like calcium faster than we break it down, so our bone mass would increase. Osteoclasts and osteoblasts can coordinate well for most of your life, but eventually the coordination can break down, and the osteoclasts begin to remove more bone than the osteoblasts can create. Symptoms. It is typically much harder to see symptoms in the early stages because bone density loss occurs gradually, but over time you may see these symptoms: back pain, a stooped posture, a loss in height, and a bone breaking easier than expected. Effects on bones and joints. It makes the bones in your body weaker and more likely to fracture, while women are more likely to develop osteoporosis. Women tend to have smaller, thinner bones than men. Estrogen in a hormone. Estrogen is a hormone in women that protects the bones, decreases sharply when women reach menopause, which can cause bone loss. Treatment: calcium, vitamin D, getting exercise, biphosphonates, hormone replacement therapy. If you've been tested for osteoporosis, then your doctor will most likely give you a treatment plan with new lifestyle changes and medication. These lifestyle changes will most likely up the intake of vitamin D and calcium with appropriate exercises. Sadly, there is no actual cure for osteoporosis, but with the proper medication can strengthen the bones. The medication taken to slow the process of breakdowns of the bones is called phosphonates, which is a drug which slows down the breakdown of bones, which gives more time for the bones to regenerate. The side effects are nausea, heartburn, difficulty swallowing, irritation of the esophagus. Hormone replacement therapy has been used as a treatment for women because it reduces the risk of fractures and used to prevent or treat osteoporosis, as it helps to slow the rate of bone loss as well as relieving the symptoms of menopause. Osteoarthritis. What is it? Osteoarthritis is a long-lasting joint condition. This is when the cartilage that overlies the ends of the joints have been broken down. This results with the bones rubbing against each other, causing lots of pain. Initially, you may only feel slight pain after doing activities, but as it worsens, even small movements or even rest may hurt. Causes. Caused by joint damage that is related to aging. When we age, the water content of the cartilage increases, the protein of the cartilage decreases. The more we use our joints over the years, the more damage we cause to the cartilage. Eventually, the cartilage begins to degenerate by flaking. Symptoms. The symptoms of osteoarthritis often develop slowly and worsen over time. But the signs you may see are pain. During movement, the joints may hurt. Stiffness. Having joint stiffness may be the most noticeable when waking up or being inactive. Loss of flexibility. You may not be able to move your joints to a full range of motion. Bone spurs. Extra bits of the bones that form around the affected joints. Effects on bones/joints. Causes changes in the bones and deterioration of the connective tissues that hold together the joint. Osteoarthritis causes the cartilage in the joint to become stiff and lose its elasticity, making it more vulnerable to damage. This makes it less of a shock absorber. Treatments. Your doctor may ask you to make lifestyle changes like exercise, lose weight, and changing your eating habits. There are several medications that you can take, some just over the counter like pills, cream, and lotion, and some that have to be just prescribed by a doctor like analgesics. This medication changes how how your body reacts to pain, but it doesn't reduce inflammation. Examples of this are acetaminophen, tramadol, and opioids. Non-steroidal anti-inflammatory drugs prevent painful inflammation and joint damage. Muscle atrophy. What is it? The term muscle atrophy refers to the breakdown of muscle tissue. Causes. Muscle atrophy can occur after long periods of inactivity. The body will eventually break down the muscle tissue and conserve it for energy. A diet low in protein and fats can lead to the reduction in muscle mass because you aren't eating the right foods to maintain your mass. Muscle dystrophy is an inherited disease that weakens your muscles over time. This is because it's lacking protein called dystrophin, which is necessary for normal muscle function. Symptoms. One of your arms and legs are smaller than the other, having difficulty balancing, remaining inactive for an extended period, difficulty speaking or eating. Effects on bones and joints. If you have muscle atrophy, then your bones are more vulnerable to damage due to the fact that your muscles aren't protecting it. Treatments. Muscle atrophy can be reversed with proper diet with high protein and fat. Careful exercise to help strengthen the bones and build muscle. Physical therapy can teach you the proper movements of the exercise for maximum results. Ultrasound therapy uses sound waves to aid healing. Surgery. Surgery can correct the deformity in your muscle atrophy due to the fact you don't eat enough. It can also correct the tendons caused by muscle atrophy.